every time, when it comes to choosing the surgery, you are confused. What should I get done? So how did you decide about getting the mini gastric bypass? And after getting this procedure done, are you satisfied, or whatever you had in your mind, is that thing, good for you? What do you want to say about MGB versus other procedures which your friends have got done?
Definitely, MGB, I will suggest to compare to any other weight loss surgery, whether it's tummy tuck, whether it's lipo, because tummy tuck, it takes you more than 6 months to a year. You can't do normal exercise, weightlifting, and plus the scarring and the uncomfortness.
So that is what made you decide for MGB and not to go in for tummy tuck.
That's right.
Yeah, because it's looks like a smaller procedure, simpler procedure, but actually it's major.
It's major.
And this is like only 4 or 5
keyhole surgery.
Keyholes, and we just change the connections inside.
That's right, and it's laparoscopic, so
and you can take bath next day. It's laparoscopic.
That's right, because my friend got sleeve done, and her experience was the 10 days were very painful. I can't change my clothes.
You're talking about sleeve?
Yes.
So she was having more pain or what?
Pain for first 10 days. It's very painful. I can't take bath, and especially when you're in abroad.
So here, what was your experience with MGB? What about the pain factor? Out of 10, how much was it?
I would say there was no pain.
There was no pain. Almost you can say 0.
It was 0, because within soon after 2 hours I was going for the urine and everything.
Yes. So let's come to that pain thing. What is the reason why you had less pain as compared to your friend? The reason is the different anesthesia which we used in your case, and you had no catheters. You could go for washroom within 1 hour of the surgery. No urine pipe was inserted. This is because of the TIVA, total intravenous anesthesia, which we are using. And then tell me about your experience in this first week of surgery. How much nausea and vomiting you had?
None.
So this is
the only golden word which I remember is you can eat, you can do, or you're drinking, you can drink anything, but it has to be a sip by sip.
Yes.
Go slow.
Chew well.
Chew well. Yeah. That's what the golden rule is.
What have you tried? What kind of solids have you tried in this week?
I'm not being very obedient patient, I must say that. But I've tried maize or what we call makki ki roti, methi, with methi, because I was craving for it.
So those hard, thick breads.
Those hard, thick, yes.
Okay.
So even though you would just have a quarter, but that's plenty for you, because you just want to taste it, right?
Yes,
basically you were craving for it.
So it gives you satisfaction here.
That's right. Okay. And then I tried it was cashew nut fudge, or kaju ki barfi, what we call.
Right.
Then I tried what we call whole meal wrap, or a roti, same thing. I've tried curry, plus I've tried the vegetables, just the puree ones.
Okay.
And rice. So I've tried fair bit, I think, solid, as well as I've tried one pinny, or we can say a protein ball, back in Sydney. Yeah.
So this is what brings luxury to bariatric surgery. Again, it's a gift by Dr. Robert Rutledge. He designed this MGB, and especially if we go by his design, what we are doing is kind of copy pasting what he taught me, because I was lucky enough to be associated with him for more than a decade. Actually, we might have done more than 1,000 surgeries standing together. So,
and I would say the way you praise Dr. Robert, the way that's the same way I praise about you, because I was lucky enough to come across one of your YouTube videos.
Okay.
I never knew anything about MGB or mini gastric bypass. I'm like, what is this new? I'm not aware of it.
Right,
then I'd try to find the difference. What's difference between the gastric sleeve versus MGB, and then I came to know gastric sleeve is only 5 ml pouch, which I don't think so I will be happy with it.
Yeah, it can be even gastric sleeve. You can make a bigger pouch 50 ml or 100 ml.
Yeah.
Here it is 200 ml. But the big thing is that outlet is wide.
That's right.
So there is no tightness at the outlet.
That's right.
Unlike the old band or in
I
sleeve
think,
also
I think
there is
band is a
pyloric
flop.
stomach.
Like in my opinion, band is a flop because
Uh-huh.
you can't put
You
anything.
have someone of your friends got
Yes.
it done. So how do they?
She
put
lost the
bands
weight.
on?
She was very happy,
Mhm.
just losing weight. But life is not only about losing weight. You want to go out with your friends, with your family. You know, food is one of our
Yeah.
social events.
Yes. Yes.
We all work hard to have that desired
Yes.
food. So she was not, and once she got married, her husband, like I said, like after a year, because how often you can see your wife throwing up every meal,
Yeah.
and then she removed it. Now she has gained weight, actually much more. So that's
See,
more sad.
yeah, because it's not just about putting a lock inside. You
Yeah.
know. Now you can understand what is the difference. Here you can eat without nausea, without vomiting. But how much you lost in 1 week?
6 kilos.
6 kilos. And
But being
what else?
sensible, you know
Yes,
how
yeah.
sometimes your brain doesn't know what to do, but with this surgery, I think you come in your senses.
It gives you sense.
You become
sense of
intelligent.
eating.
Suddenly you think, oh, I know about
Yeah,
food. I know what to
because,
consume.
it's not stopping you from eating.
Yeah.
You are eating into the intestine. And intestine is delicate. It cannot handle big volumes. After eating a moderate amount of food, you feel satisfied.
Yes.
This is the main difference here. You don't feel choked. Your brain says, no, I'm done. I don't want more. And that is exactly what we want to have, the feeling after bariatric surgery. So this is quality
It's
of life.
yes, because I strongly
without
believe
throwing up.
that's
Yeah.
right, and I
Yeah.
strongly believe that you need to have more. You need to be hydrated, which this surgery allows you. So
Yeah.
sip by sip,
Yes.
which is right. You know, having more salt.
But then it's a stronger procedure,
Yep.
and then it's a double-edged weapon.
Yeah.
You know, you don't take it lightly. It's very strong. If it's giving you weight loss,
Yes.
that means it can take away certain other things which are very important for the body, like
Yes.
bring down your iron to a lower level, or calcium and other vitamins as well. So with this, you need a little bit more precaution about choosing your foods, so
That's
that
right.
whatever you're eating should be nutritious.
That's right. More
Yes,
protein.
eat less
based.
but eat more protein.
Yeah. So
You're
whether
eating
it's
less volume but eat healthy.
Of
So
course.
all the times you should be focused on, oh, what's giving you more protein. So
That's right.
don't take bread, take chicken, fish.
Because you don't feel actually good.
Yes.
I wanted, because I've got thyroid,
Okay.
I wanted something
So you
which
don't-
can make me hate carbs.
Okay. So you think this procedure is
Yes.
making you change your
That's
eating
right.
habits as well?
That's right. Like suddenly, like you know how before when you look at the food, I would be thinking how much carbs I can consume,
Right.
because I need to go to gym. You know how you think X,
Yes.
Y, Z, whereas you don't need carbs because you're not doing that much of manual work these days.
Yeah.
But then like with this, your purity changes, so
Yeah.
you're choosing the right food. That's why you become more sensible.
Again, it's because now it's the intestine which is behaving. It's
Yeah.
not that old stomach bag which
That's
would
right.
welcome anything and everything.
That's right.
But here, this delicate intestine tube doesn't like direct carbs, direct sugars,
That's right.
and similarly, thick milk, you know, which is high in fat. Your intestine will not like it, but you will like buttermilk, lassi.
Yeah,
other
actually,
things.
you
So-
feel.
so
I never used to
gradually,
drink
you know,
lassi, to be honest with you.
Okay, now
But
you're-
after this thing,
Okay.
I'm addicted on lassi, and I'm
Yes.
like, yeah, I feel good about it. It's easily
Yeah.
digested. You
So
feel
th-
energized.
So these our patients need to be a little bit learned on this subject, that this surgery is actually anti-health.
Yeah.
This will decrease your volume, your body weight, but we don't want to see you thin and weak.
That's
So
right.
for that
to
you
have
need
more.
nutrition
That's
and
right.
vitamins, and the main thing which can go down is iron with weight loss and gastric bypass. So be careful about your iron, because all the young ladies have this problem because of blood loss, everyone.
That's right, after
On the
30.
top of that, you are losing weight, eating less. So if you are cooking at home, so make it a habit that you cook in iron utensils as far as possible.
I was telling my husband, I'm like,
Yeah.
we need to invest some in iron utensils.
So
Yeah.
and then keep on taking iron tablets. Ferrex is the best.